And as a next presenter, I would like to welcome Professor Kuldeep Kumar Pandey and his presentation about ancient techniques for pain control have always been integrative, not only chemical. Please welcome.
Thank you. So, namaste to all of you. I have come from India and having a lot of journey regarding the pain. I have come here not only to share my experiences regarding the pain, but I have come here to learn what you people think about pain and how you are going to manage that pain. So I especially thank to Mr. Thomas and the entire team providing me this opportunity to share my experiences. I invite all of you to have a small journey of pain with me. In my presentation, first I would like focus on the journey of pain when we take birth. We feel pain, our parents feel pain, and throughout our entire life, we feel somewhere external and internal mediated stimulus-induced pains, and ultimately the well-decided destiny when we go to heaven, we leave pain behind the family and the society. So this is a small journey when we go for that one. But what happens when really we are in agony or in pain? The whole pleasantness per definition of the Ayurveda, Samadosha, Samagnisha, Samadhatu, Malakriya, prasanna happiness, prasanna atmendriya mana swastha iti abhidhiyate. Meaning that if you are having whole system in a harmony, each and every cell of the body is in rhythmic motion and in harmony, I am giving a pleasantness to you. And when it becomes reverse just of that one, that is coined as a pain, what I think. I started to understand what the pain is when I was in class 10th standard in 1975. I have come to observe a saint of having a fracture in his hand. Doctors were suggesting him to operate, the ultimate remedy, but he was very much worried about the anesthesia and whether he will come over or not. So he asked, can you give me a herbal product that is cannabis? I would like to have the smoke of that one and you can operate. And that was. Second, after 2-3 years when I was a university scholar in 1979, I was going on bus and found a person who is having severe pain in his chest and he was just agony. Then I noticed that there is a chest pain. And when I joined as a PG scholar in anesthesiology in 1988, I was posted in the labor room and found that a lady going to be mother very recently, she was in pain. That was the natural pain of the labor. And that was the another observation for how I make anesthesia to the patient and she was get rid of the pain. Then usually I used to go in the operation theaters and used to find that there are certain type of post-operative pain. And that pain was not only with the patient, that was also with the attendants also. The person, those who are caring to the patient, they were having a lot of either type of pain. And it is very difficult to understand the pain who is really not a patient, but is having a pain while attending a patient of a pain really suffering. So then many a times I found a patient having, it is nowhere that is somatic pain, but the patients are suffering with the psychological pain. In the first Zoom meeting, some of the speaker, when we were having an introduction, said that, what about political pain? I was very much surprised. Yes, it is. So there are many more types of pain. And as my specialty is cancer patient pain management and palliative care, I used to go daily with the patients of cancer or suffering. Poor patients, they have different types of pains. So this was a small journey where I absorbed the smells, many types of the pain, how it happens. And then only you can. But my dear friends, when we feel pain of our own self, we say that, yeah, thank God, I am alive. But the moment you start feeling the pain of the society and others, really you are a human being. So right now, start feeling pain of the society and the other persons. Then you will analyze what the real meaning of the pain is. This is the real fact. What is going in the whole universe? Man, machine, medicine, power, money, everything is moving to a nucleus. That is the pain. Why we are gathered here? We are here just to find a solution to make health. And pain is just reverse to health. So everything is there, moving round the clock to the whole of the system. But I have made a reverse direction, moving in either direction. Why? Because we are forgetting the ethical values to solve the problem of the pain. We are engaged earning the money, how we can cheat the society. I may be wrong, but it is happening there. So we have to change our mind to serve that society, to serve the nation. That is my motive. Now, a big question arises. What the real meaning of the pain is? I have made a slap to a person, he is feeling pain. I have said ugly words to a person, he is feeling pain. A person is hungry, he is feeling pain. A person is desiring some more money, but not, he is having pain. So what the real definition of the pain is? This is matter of debate. And what the pain management? Pain is not a single word that you can manage just giving a simple painkiller like pharmaceutical companies are giving. This one is a paracetamol preparation and you give every type of pain will be subside. No, not at all. Then how can this information help? If it is different meaning, there is no ultimate single remedy, then what information you are going to have and what will be your contribution? So, if you go long back in the ancient period, the term was coined in Sanskrit Vedas as Ach, Ag, Vedana, Shula, Dokha, and other meanings. Because according to principles of Ayurveda, Dr. Kirti, we are discussing right now, that there are three principles of fundamentals of Ayurveda. That is the Narte, Anla, Drga. Without Vata, there you will not feel a pain. The Vata has many characteristic features. Usaho, Chvasa, Niswasa, Chesta, Dhato, Gati, Sama. All circulating informative system is under the control of the Vata. So that is the main causative factor which gives information in terms of the nervous impulses and mind start thinking about that this is something wrong with the normal homeostatic physiology. So this is resembling that. Understanding of pain is very difficult. You are going to gather information for making a diagnosis. And it is very difficult to. Because you're having inspection, patient is coming to you, you inspect, yes. Then interrogation, what type of feeling do you have? Then investigations of laboratory. But you are getting very little information like an iceberg floating on the water. A big story of the pain is inside the patients. And that you have to read each and every line of the text, that is the open book, that is our patient. So you have to learn. And what you have to learn? This one: biological factors, social factors, and psychological factors. Without that, you are just unable to learn about the nature and intensity and the quality and characteristic features of the pain. Unless you are not going to have that much information, it is very difficult, and I can say it is quite impossible to diagnose and treat the patient of pain and sufferings. So there are many more challenges. We were discussing with Madam that we are having a lot of challenges. Challenges in terms of limitations of our drugs. There are many more modalities, maybe. There are many more alternatives of the treatment, maybe. There may be many more pain thresholds, but none of are deprived of ill effects. So challenges are still there. So we have to think about the alternative medicines. And that is because sometimes pain is there, but consequences are parallel to the pain. And that is a patient suffering from pain. He says, "Oh, doctor, I'm having a very high intensity of pain, and God is not giving any concession to me. I want some sort of concession of pain. Oh, Lord, give me some sort of concession. Because with that pain, I have a lot of consequences, that is depression, suffering, sleep, and other things. That must be improvised when the treatment is being given." So, as comparing to the current allopathic system, I will not say the modern system, allopathic system of medicine, because they are just parallel to us. And the allopathic system came into existence of medical armamentarium very late, but in TCIM, we are having a lot more modalities of that has been discussed earlier. I will not go into detail, but I will share my experiences regarding the clinical observation. So I have worked on a large number of the drugs mentioned in the text of Ayurveda having the analgesic properties, and simultaneously they are having the effect on the psychological disorders too. These are a large number of drugs. I will not go into detail, but I am going to introduce that one. Recently, the miracle drug is cannabis. I'm using that cannabis suppository extract of the cannabis in my surgical patients. I used to give cannabis suppository to the patient immediately after the operation, and patient is free from pain. Up to 24 hours, there is no need of giving any injection or any other remedy for the pain management. That is the herbal drug I'm using there. Then in my cancer patients, I use the cannabidiol, and that is the whole extract of ethanol of the cannabis, and using that sublingually, 2 drops of that, and patient get rid of pain and pleasant life, that one. I'm using pain management through Ayurvedic system of medicine, that is the Agni Karma, the metal of 5 alloys, using and make it red hot, and using on the pain point, that the carbuncles are there, corn are there, low back ache is there, knee joint pain is there. I'm using that one. And another one in the lower slide, you will find the patient of MRM, that is the resection of the complete CA breast and having some sort of the problems. And that time it was not cured. There were non-healing ulcer. And that time I used this cutlery with the alloys and dusted over the WHC. There's a glycerol powder, and then the marigold juice over that. You will find the miracle result of TCIM. Then you may find the herpes problem. With the leech application, it is one of the another remedy is mentioned in the text. And the lady with the pimples on overhead, and you will find the thrombosed bile mass is there, so everything is going to be treated. And this is your first slide. You will find there is the pain in the. I'm using the marma therapy, and anyone who is having some sort of the pains, I will cure within 2 minutes with this marma therapy. You will find there. Then the cancer patient having squamous cell carcinoma, I have used this one only, and you can see the miracle result that is evidence-based. And I'm using this Nasium with the herbal drugs for the migraine, and patients are getting benefited. And these are applications of aromas where it is very difficult to have application of different injection, oral medication. You can use the aromas. Patients are cheerful, having analgesic properties. So make an umbrella of different specialties of the TCIM, and then you find your patient is well protected under the umbrella. So care with the TCIM. And someone asked, I said that best medicine for human is care and love. And many people ask me, oh, Dr. Pandey, if it is not work, I said simply smiling, increase the dose, that will work. So thank you all for your patience listening. Thank you.
Thank you. Thank you, Professor Pandey, for giving us a different angle from which we can look at pain and helping us understand how to approach being free from pain.